Astronauts in scrubs, bridging the void of healthcare's fragmented cosmos. Navigating communication gaps and fragmented responsibilities through the astronaut metaphor in an ethically driven digital omni-resource supply chain. By Dr. Patrick Schur, professor in E.D.S.C, founder of the theCwind Solutions in California.
Healthcare systems today are more complex than sending humans to space. NASA can track every bolt on a spacecraft in real time, but hospitals still struggle to share even the most basic patient records seamlessly. That contradiction is at the heart of the discussion today.
It's striking when you put it that way. We have the capability to monitor astronauts' vitals from orbit, yet here on Earth, a person can walk into an emergency room unconscious, and the doctors have no immediate way of accessing their medical history. It really puts into perspective how broken our system is.
That disconnect raises a deeper question. Why? With all the advances in technology, why is something as fundamental as medical data still so fragmented?
It's not the technology that's the problem. The framework already exists. The theCwind solution in collaboration with the university, ETH Zurich, the Internet Engineering Task Force, IETF, and the Wide Web Consortium Inc., W3C, has built the architecture, secured patents, and developed the infrastructure for what they call a co-internet system, a decentralized yet fully integrated digital passport for health data based on a biometrically secure internet protocol, the Bio Cross-Chain Collaboration Cooperation Coexistence Internet Protocol, BCCCOP. The challenge isn't the tech, it's the human element: resistance to change, institutional inertia, and outdated governance models, and outdated General Data Protection Regulations, GDPR, and outdated HIPAA law.
So it's like trying to adjust the course of a spacecraft mid-flight. You can't just flip a switch. It requires precision, trust, and incremental adjustments.
Exactly. And that's why this approach isn't about replacing what exists. It's about creating a parallel system. Imagine constructing a new space station while keeping the old one operational. That's what they're doing, ensuring a seamless transition rather than disruptive upheaval.
That reminds me of how astronauts operate in space. Every move, every decision is intentional. There's no room for error on the personal level. How does that philosophy translate to healthcare?
It's all about discipline and trust. This new system isn't just about data ownership. It's about ensuring 360-degree trust in a four-dimensional, continuously evolving space. Instead of static screens or fragmented records, imagine a digital presence that follows you, always synchronized, always addressable, yet fully personal and protected. This isn't about delegation. It's about personal responsibility over your data.
That's a paradigm shift. Right now, we see biometrics as a way to access data. But you're saying the real transformation is that the data follows you. And because of that, security and self-sovereignty become even more critical.
Exactly. The moment digital follows you, the nature of access changes. It's not about logging in. It's about existing within a continuously connected framework. And because it follows you, protection has to be embedded at the core. It's not an afterthought.
Let's talk about real-world applications. How does this system impact emergency medicine?
Imagine an unconscious patient lying on the road as an emergency team arrives. Instead of doctors scrambling to piece together their medical history, the system instantly provides a complete, context-aware profile, including medications, allergies, and recent treatments. Studies show this could reduce critical decision-making time by 60% and cut medical errors by nearly half.
That's a dramatic improvement. But beyond emergencies, what does patient ownership of data actually look like?
Think of it as mission control for your health. Instead of scattered records across different systems, your health data is continuously available to you, addressable and accessible only by you or those you trust. Patients regain agency over their information and project them, and physicians gain clarity in real time without administrative barriers and channel barriers.
But cultural and institutional inertia are powerful forces. How do you get hospitals and governments on board?
That's where the trust-first approach comes in. Instead of pushing for a complete system overhaul, the project focuses on proving impact through targeted implementations. By developing common AI foundations for digital identities and seamless human-digital interaction, they're already achieving real results, like reducing emergency room wait times by 30% in one hospital department. Just like in space exploration, success happens step by step, through incremental progress.
That approach mirrors how NASA validates new systems, small, controlled deployments that gradually expand as trust and efficacy are established.
Precisely. The technology is ready, but this is about responsibility. It's not about handing over control to institutions. It's about individuals owning their health, their data, their future. Just like space travel, the next frontier isn't about machines. It's about how humans interact with them in a way that ensures trust, security, and autonomy.
So, the key takeaway here: healthcare transformation isn't just possible, it's necessary. But like every great leap in human history, it starts with disciplined steps, technological readiness, and a willingness to trust in the process. The moon landing didn't happen overnight, neither will this. But the first step is clear. The only question is, do we have the courage to take it? Read more under www.artofdigitalshadow.org.